Here's how private hospitals loot helpless patients and how it can change. Even before the pandemic, India's private healthcare system was largely unregulated, inaccessible, and unaffordable for common people. A 2018 report showed that private hospitals earned up to 1,700% profit by inflating medical bills. As per government estimates, as many as 6 crore people are pushed into poverty due to medical expenses every year. Here's how private hospitals, which were meant to save lives, have become money-making machines. 1. Inflation of medical bills. The failure in enforcement of right regulations has left private hospitals with a free hand to charge patients as per their own norms. Apart from hospitalization and medicinal costs, disproportionate charges are levied on consumables like injections, masks, and personal protective equipment. During the COVID-19 crisis, despite price caps and government regulations, private hospitals excessively overcharged patients, and in some cases, PPE costs made up almost 50% of hospital bills. 2. Discrimination towards marginalized communities. Under-regulation of private hospitals hits the poor and marginalized communities the hardest. Many hospitals have been known to withhold bodies of the deceased in order to pressurize their families to clear their bills upfront. In some cases, private hospitals even refuse treatment to patients based on religion, which is a violation of patients' rights. A 2012 report to UN on the indigenous people's rights revealed that nearly 7,000 women were subjected to forced removal of their uterus in Chhattisgarh's private hospitals. Such incidents only show the need for stronger measures to uphold patients' rights. 3. Exclusions in health insurance. People spend their hard-earned money to buy health insurance to avoid unforeseen medical expenses. However, inflated bills and exclusion of pre-existing conditions frequently lead to rejection of claims and reimbursements. Out of the 22,955 crore rupees filed as COVID claims, only 11,794 crores have been settled as of May 2021. 4. Underutilization of government health schemes. Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, the Government of India's National Health Insurance Scheme, was introduced to provide free healthcare access to people from lower income groups. However, the scheme helped very few people during the pandemic due to denial of treatment and overcharging by private hospitals. RTI data showed the scheme has provided treatment to only 19 people in Bihar, 875 in Uttar Pradesh, and 1,419 in Jharkhand. The Clinical Establishment Act and Charter of Patients' Rights were introduced by the Union government, but these instruments remained unused during the pandemic. Rising public pressure resulted in several state and union territory governments capping prices for the duration of the pandemic to provide temporary relief. But these measures can't fix problems in the long run. State governments also need to empower citizens with patients' rights through grievance redressal mechanisms. Citizens and governments must come together to prevent commercialization of healthcare and ensure that rights of patients are prioritized over profits of hospitals. Raise your voice to demand stronger regulation of private hospitals. To join Oxfam India's Rights Over Profits campaign, give a missed call to 77318 76318.